In this video today, we shall be talking about dialysis. Hello everyone, my name is Dr. Hussein Baga. I'm a consultant physician and kidney specialist working at the MP Shah Hospital in Nairobi. Dialysis is one of the modalities of treatment that we have for patients who have reached end-stage kidney disease. Now, if you remember our previous videos, we talked about the functions of our kidneys, which are very important organs. The kidneys help us to remove excess water from the body. The kidneys help us to remove toxins from the body. The kidneys help to regulate our electrolytes like sodium, potassium, phosphorus, calcium. The kidneys are also very important when it comes to synthesis of certain hormones like your vitamin D and also erythropoietin, which is responsible for your hemoglobin levels. So when somebody has reached end-stage kidney disease, the kidneys are not functioning, and this is why patients who have reached end-stage kidney disease then develop the symptoms, which include having difficulty in breathing, or they find that the legs and the face are swelling up because of water retention. You find that they get a lot of nausea and vomiting because of the toxins building up inside the body. They also start itching as well because of the toxins being deposited under the skin. They become weak and are not able to perform the daily chores because the level of blood has gone down. They also tend to get muscle aches and pains because of the vitamin D levels being quite low. So when somebody reaches end-stage kidney disease, then we need to initiate what is called renal replacement therapy, and dialysis is one of the forms of renal replacement therapy. Kidney transplant is the other form of renal replacement therapy. But in this video, we're going to be focusing on dialysis. Dialysis takes over the functioning of the kidney. It is not a cure for end-stage kidney disease. Dialysis is a surrogate kidney that does the same function as what the kidney does. So there are two types of dialysis. One is called hemodialysis, which is what is commonly available here in our country, Kenya. Hemodialysis involves putting in a catheter or a pipe which connects to one of the major vessels in the body, or joining an artery to a vein, or what is called an arteriovenous fistula. And what happens is, this is connected to the machine. Either the pipe or the catheter is connected to the machine, or the fistula is connected to the machine. So the blood from the body runs through that machine, which is a surrogate kidney. It removes the excess water that we want to remove. It removes the excess electrolytes that we want to remove. It removes the toxins from the body. And then the cleaned blood is basically returned back to the body. The other type of dialysis is called peritoneal dialysis. Peritoneum is a covering which is found within the abdominal cavity, okay? And a pipe is put inside the abdominal cavity, and we put in some specialized fluid inside the abdominal cavity, which after 4 hours is removed, and the same thing happens. There's a lot of exchange of electrolytes, excess water is removed, and even the toxins are removed as well. No, dialysis is not painful. Once when we have the excess, which is either the catheter or the arteriovenous fistula, then it is not painful at all, because you just connect the pipes to the machine, the blood runs through the machine, and then subsequently is returned back to the body after having been cleaned. So one requires dialysis when one has reached end-stage kidney disease normally. That is when your kidney function is less than 10%. However, sometimes you do start dialysis early if you have a lot of water in the body which we cannot remove with the help of medications, or if your potassium levels are very high, or if there's a lot of acid buildup in the body. The important thing to remember is that dialysis is life-saving. Okay? When your doctor does recommend dialysis for you, then it means that you have reached end-stage kidney disease, and the level of toxin buildup, the level of acid buildup, the level of fluid retention is quite high, and this is going to be affecting your quality of life, and that is why you will need dialysis. How often do you need dialysis? Most commonly, you need dialysis twice weekly. Some patients who do not have any urine output require 3 times a week dialysis, and we do dialysis most commonly over 4 hours. So it is routinely done over 4 hours, twice or thrice a week. What happens when you started on dialysis? So if it is end-stage kidney disease, then we do recommend that you do enroll yourself for a kidney transplant. So if you are eligible for a kidney transplant, then your doctor would advise you to start looking for a donor who is preferably a relative, a blood relative, and who should be of the same blood group as you, or who can donate blood to you and should not have diabetes or chronic kidney disease. And then subsequently, your doctor is going to work the two of you to make sure that you are both compatible and that the donor is going to be safe, and even you as a patient, you are going to be safe. So it is recommended that the person who is donating the kidney to you is going to be a relative for now. We are also working towards developing a deceased donation program here in Kenya. Unfortunately, we do not have a deceased donation program in Kenya. So I hope that this video has been useful, and if you like it, please share it, and please subscribe to my channel. And if you have any queries or questions, please post them on our social media platforms, and we shall definitely answer them for you. Thank you very much, and have a lovely day.